Just to let everyone know, this session is being recorded and will be made available on the ABHI website, which we'll give you further details about so that you can share them with your colleagues if they haven't been able to attend today. But thank you all for joining us today. Many of you have had conversations with me in the lead up to Medica for the last year, so I'm sure you're aware of who I am, but as a quick introduction, I'm the head of international events at ABHI, of which Medica is one of the shows I lead on. As part of the support we offer at Medica to exhibiting UK companies, this webinar is to aid UK SMEs in getting ready for Medica next week. The information we're about to hear is a great opportunity to have advice ahead of the show and to help you get the most out of exhibiting and joining the UK Pavilion. So on to some housekeeping rules as a normal thing that we have to do with these webinars. Please can you put your phone or computer on mute unless you have a question. Please use the chat function to send through any questions. We'll have a 15-minute Q&A at the end of the webinar. To get the most out of the session, we encourage attendees to engage and ask questions. As I've mentioned, the webinar will be recorded and will be available on the ABHI website, and we'll send through details for that. So now on to the actual webinar itself, the important part, and I'm delighted to introduce our first speaker, Richard Charter. Richard has 15 years of experience in financial economics, health economics, consulting, market access and pricing for medtech companies. Richard's background with in-depth industry insight shows that he's previously served in variety of industry, trade and health economic organisations in senior roles, including chairperson. So thank you, Richard, for your time today, and over to you.
Thank you very much. Thank you very much. Appreciate that. Let me share my screen here. Okay, so let me know when you can see my screen.
Yes, we can see it.
Perfect, thank you. So what I'm going to, I just want to sort of set the stage for the attendees on the call here today. You know, there'll be more of a deep dive in Germany as we go forward, but I'm going to sort of lay out sort of some of the key considerations for Europe overall. There'll be a lot of content. I won't go into everything that you see on the slides. I will be sending this presentation around afterwards, so please feel free to reach out to me afterwards if there are questions, but let's just jump right into it. One point of housekeeping, unfortunately, I won't be able to stay around for the Q&A at the end of this session. So if there are questions, please send them to Michelle, and she'll either send you my presentation or pass along my contact details, at which point you can reach me directly as well. Okay. So I think the first sort of thing to consider is, you know, and this is not only what Alira Health does as a company, but I think it's also relevant to the medtech industry overall. And I think this is a really important consideration for any company looking to succeed in the European market. I often call medtech a successful failure. And what do I mean by that? So medtech is one of the most innovative industries as measured by patents being filed. Okay, there's about 8% of total R&D revenues are from medtech themselves. And when you look at how the medtech industry files their patents, you'll see that the ratio of what is granted to applied for is actually higher than that of the pharmaceutical industry. However, and this is a big however, many technologies still fail to be adopted within the market. And that begs the question, why? Why is there such an important distinction between companies that are launching technologies and those that are adopted in the market? And I think a lot of it comes down to what we call the product adoption curve. So I'm sure many of you are familiar with this, but let's put it quickly in the context of Europe and medtech companies overall. Many companies consider CE mark to be the final sort of endpoint, if you will, for company success. But all that really does is ensure that your technology is safe and effective, and it means essentially the door is open to the EU market. Now in the UK, we'll see the UK CA mark start to take this on as well. But ultimately, many companies consider that regulatory component to be the final endpoint, but it's not. There's a lot of work that needs to go in post-CE mark or post-UK CA mark before your company can be successfully adopted. really what I would suggest is that the endpoint that you should be considering is HTA decisions, reimbursement, coding, and funding. And that's really what we call market access. And there's a significant time difference between a regulatory submission and a reimbursement decision. And I would suggest that there needs to be as much energy going into reimbursement, coding, and funding decisions as what goes into regulatory submissions. Some of the things that are crucial in order to do that would include the type of evidence that you need to generate and the types of trials that are necessary in order for payers to understand the value of your technology. Clinical trials are not just for patient safety and efficacy. Clinical trials are also for comparative effectiveness to make a reimbursement decision. And that includes things like real-world data and analytics collection, innovative funding pathways, and of course supporting the users, whether it be the physician or the patient, in the learning curve to make sure they actually understand your technology. And it's these considerations here that lead to that big discrepancy between the successful measurement of innovation as measured by patents versus the number of technologies that are adopted. And that's really what I myself and Alira Health look to do, is support companies through this entire product life cycle such that we are not a successful failure and the technologies that we're launching are being adopted. Now, if you look at the European market overall, we can see that about 77% of all spending in Europe goes to the inpatient and outpatient care settings. Those are the buildings, the nurses, the doctors, the physicians, the operational elements, if you will, of healthcare. About 16% is spent on the pharmaceutical side. So that would be the drugs and the therapies that we typically see from the pharmaceutical space. Only about 7.2% is on medtech. But what really strikes me in this number is that although only 7.2% of European healthcare funding is spent on medical technologies, the amount of efficiency that they can drive across that 77% of inpatient and outpatient care is staggering. And that's really where I think the value of medtech comes in. And that's really where I think that if you can create your value proposition to demonstrate greater efficiency in that 77% of spend, I think medtech really has a place at the table in order to do that. So the medical device market size in Europe, it's about 115 billion market, about 27% of the world total, and it represents the EU overall, including the UK, by the way, represents the second largest market after the United States. So what's the breakdown of those sizes across each of the countries? Well, we can see that the UK represents about 11% of the total EU market. Italy is about another 10%. France is about 15%, Spain 6%, and interestingly, Germany 27.4%, which is one of the largest markets as measured by patient population. That said, the population size and the revenues attached to each of these countries, they may not be where the best opportunity lies. And that's one of the key nuances that we'll talk about a little bit here as well. So that's a little bit about the medtech overall as an industry. That's a little bit about how Alira Health supports companies, and then this is sort of the market dynamics overall. So my name is Richard Charter. I am the Vice President of MedTech Market Access at Alira Health. Just by way of disclaimer, the views represented here do not represent ABHI, Medica, or any of the other organizations which I represent at present. But my contact detail is on the screen, and you can always reach out to me if you have any questions. So let's go a little bit deeper now on some of the key trends that are emerging once we understand sort of the overall dynamics in the market. So one of the reports that Alira Health has conducted is we've identified about 35 innovative funding pathways around Europe. And you can see them all listed here. I'm not going to go into each of them in detail. There are quite a number of nuances to them. But the key point here is that these are essentially early access pathways for earlier stage companies who are looking to define their value through some sort of clinical and economic evidence generation plan. And we've got detailed analysis on each one of these pathways, but finding the ones that are most suitable for your technology could be one of the more interesting early launch sequences. You can see in Germany there's about 6 different pathways that are listed. Depending on the type of technology that you have, it may or may not fit for some of them going forward. We've updated this report, and the reason I highlight this slide is because you can see how quickly this space is changing. So some of the changes that have come through, we see some additions in Belgium. We see either stopped or changed pathways in England. One of the French ones has stopped, the ETAP program, and they've added to translational coverage. It's a rapidly moving space, and really part of the reason it's so rapidly moving is because as innovation looks to be launched in each of these countries, countries do need to support innovative pathways to support the technologies that are coming through on their horizon scan. But overall, there are about 35 different programs highlighted. Some are more for the inpatient devices, which we can see on the leftmost column. Some are only for digital devices. Arguably, one of the more popular ones is the Medica platform in Germany, and we've got a lot of information on that if anyone's curious about it. There's a very similar program coming up in France, which is essentially modeled on the German Medica pathway. And then there are other specifically digital pathways as well. But what you'll see is that not all of these pathways will support medical devices, diagnostics, or digital health, nor do they support technologies that are in either the inpatient or outpatient care setting. So understanding where you're looking at launching your technology becomes absolutely crucial. So let's give you an example in the UK of the 6 different pathways that we can see here. So we can see the MedTech funding mandate, and that really is an NHS long-term plan commitment to accelerate the uptake of selected NICE-approved technologies. There's the Innovation Technology Payment Program, which supports low-cost innovations that can deliver savings in a relatively short period of time. There's the NHS Insights Prioritization Program, and that's really designed to accelerate the evaluation and implementation of innovations that support post-pandemic ways of working. We see the Small Business Research Initiative, the NHS Innovation Accelerator, and then, of course, the Artificial Intelligence in Health and Care Award. Each of these programs have got nuances to them. Some technologies will apply, some will not, but ultimately, these are pathways that you may want to consider. The MedTech funding mandate is one that has seen a significant amount of interest, and that's largely because it does mean that a technology goes through NICE, which is the Health Technology Assessment Body in the UK. And once you get that NICE approval, if you get that NICE approval, then it comes with a funding mandate, as the name implies. One of the challenges that MedTech companies have is that when they do go through an HTA in any European country, there's often not a funding mandate attached to that decision. So the fact that the NHS in England has launched this through NICE, I think is a really nice, elegant way of bringing in some technologies. The downside to this, to be candid, there's very few technologies that have gone through. There's not much bandwidth to add that. So it's a bit of a lottery as to how the companies actually get selected to go through this pathway. But these are the types of solutions that do become quite interesting, and there are analog programs around Europe. We can see some of the technologies here that have gone through. So for example, the Securicath or the HeartFlow or the GammaCore, we can see that these were selected, and therefore they have been they've been offered funding as a result of the successful program. Technologies for 22-23, we can see them listed on the left-hand side there, but it really does represent a variety of different technologies, and you'll want to see if your technology will fit into this specific platform overall. Another interesting one in the UK, for example, is the Net Zero SBRI healthcare competition. And this really is a 2-phase approach to support innovative solutions that focus on decarbonizing clinical pathways that are the more intensive carbon pathways that are out there. And you can see that the stakeholders involved are NHS Green, the Academic Health Science Network, and then, of course, the Accelerated Access Collaborative as well. But these are the types of pathways that are showing up that can really help to accelerate the adoption and the introduction of your technology. And this one specifically has about 1 million for various healthcare competitions, and as a result, some of the pathways become more open and available. You can see the timelines listed there, where some of the contracts were awarded in January will be awarded in January of 2023. But these are the things that you'll want to start looking at as you're launching your technologies. I think that one of the key points here is that it's really crucial to understand exactly how these platforms work, and more importantly, why they are there. So something I really want to emphasize to any company looking at launching a technology in Europe is what we call the value challenge. The person benefiting from the technology, the person recommending the technology, and the person paying for the technology are 3 very discrete entities. Each of those need to be looked at in the context of pathways such as what we've just discussed, or as a general value proposition to any stakeholder. And we need to remember that that's confounded by what we call the macroeconomic and population health trends. So we see rising costs in healthcare, we see rising demand for healthcare, we see shrinking government budgets, and now, of course, this trend towards sustainability is coming in. And each of these need to be factored into that what we call value challenge. And that's why putting every single value proposition you have in the context of sustainable value will be a determinant of success for any company looking at launching a technology in Europe. And that is ensuring you've got a good understanding of the health and environmental outcomes of your technology versus the total cost of delivering the benefit of your technology overall. Without that, I think your technology may suffer. So let's get into some key takeaways, and then I'll turn it over to our next speaker. So number one, remember the value challenge. You need to have a value proposition to each of physician, payer, and patients. And there are basically 5 C's of European launch success. The first one is cadence. What is the launch cadence you're going to have for each of the countries that you have identified to work in? And remember, population size is not always the right place to start for the first launch. Number 2, comparators and competitors. You have to know the current treatment paradigms, the current standards of care, and competitor technologies and competitor treatments that are out there. So there may be a technology you think is a competitor, but there may also be an effective treatment that doesn't have a competitor technology, but both of those are taking the same patient pool. So you need to understand the comparators and competitors. The third one is the care setting of your technology. Launching in the inpatient versus outpatient versus home care settings can be significantly different from a reimbursement perspective. And we often see a situation where clinical evidence is generated in an inpatient setting. The company wants to launch in the outpatient setting, and the payers say, no, we need to see the same care setting. So mapping that out is absolutely crucial. Number 4, coding and coverage. Is there a pathway already available? If a code already exists for your technology, your market access pathway can be significantly different. Then it just comes down to number 5, which is making sure your commercial strategy fits around that coding and coverage in of itself. And that's where the evidence generation versus more of a sales push can become a crucial determinant for success. So that's the overview on Europe. Those are sort of the 5 sort of key things that you can take away as a barometer, if you will, for launch success. And if there are any questions, you can reach out to me after this session, or you can reach out to Michelle and she'll forward the questions on to me. But thank you very much for your time. I do appreciate it. Michelle, back over to you.
Thank you, Gabriel. That's Richard, that's absolutely fantastic. Some really, really great advice given in there. I think we can all agree things for us to be thinking about, not just at the show, but in terms of our planning for the year ahead as well. But thank you for your time. And as Richard said, he has to jump off now, doing another panel session himself. So if there's any questions, do get in touch with either myself or Richard, and we'll be able to get back to you.
Thank you. And I'll send a PDF around to you. Okay, Michelle?
Perfect. Thank you very much.
Thanks, everyone. Appreciate your time. Bye-bye.
Cheers.
Thank you.
So on to our next speaker, Gabriel Fleming, has kindly offered his time today to give advice on the German market. So we've had an overview of the European market, and now we're going to drill into the German market, obviously being quite relevant for Medica itself. Gabriel provides a free and full service portfolio of the German government, i.e. German trade and investment in international medtech manufacturers ready to build and expand their footprint in Germany. Gabriel will also be at Medica as well. I think you're in hall 15 if I'm not mistaken. So if anyone has any questions and would like to follow those through, obviously able to see him at the show. But over to you now, Gabriel.
Yeah, brilliant. Thank you, Michelle. I'm all set and sharing my presentation now. I thought it was a brilliant introduction of Richard's to the EU medtech market access. I like to say that market access really is a medal with 2 sides, right? And you have to integrate both perspectives. One is certification, the other is reimbursement. And oftentimes it's advisable to devise a strategy that starts out with integrating both perspectives, right? And that can be quite complicated. Anyway, so, right, Germany Trade and Invest is roughly comparable to UK's DIT. So GTAI, we're the Economic Development Agency of Germany. Trade refers to an information service that we provide to German companies that are interested in exporting international markets. So we have 50 or so offices abroad with market correspondents putting together market analyses in a standardized format. And I'm with the Invest branch here in Berlin. Invest refers to foreign direct investment into Germany, right? So we're rolling out the red carpet to, let's say, UK companies, but from anywhere in the world who are interested in becoming established in Germany, essentially, right? And to, at some point in the future, set up a rep office for sales purposes, or maybe even manufacturing, right? To be closer to your clients here, or to engage in R&D collaborations. This is all things that we can support, right? So as Michelle said, everything we do is free of charge, dedicated once again to those companies that are looking to become established in Germany in the next couple of years. So we're providing free information on the markets, right? Who is who and where are they in Germany? We got maps, we got all these statistics. We also have a legal help desk in-house, right? And they can cover questions like, what does it take to set up a limited liability firm in Germany, right? That would be a GmbH. But also talk about customs. We include tax information, right? Tax levels in Germany vary throughout the different administrative areas, right? And then we also provide overview of incentives, right? There's incentives for manufacturing, but also R&D collaborations. We'll introduce you to such partners as hospitals for clinical trials, for example. And of course, our endpoint is to help you find the best place in Germany to run your business, right? So just to give you a big picture idea of the relevance of healthcare in Germany, right? It's actually the largest industry. It's the largest sector within the German society, spending 466 billion euros, total of 466 billion on health issues. This includes reimbursement, hospital expenditures, but also consumer health, right? Very, very high relevance, 12.5% of the gross domestic product. That puts us up to the top 5 throughout the European Union. There's some 80 million people living in Germany, and some 90% of them have public health insurance. The other 10% roughly vote or opt for private health insurance, right? They pay a little bit more for their coverage, and in return they get let's call it single rooms in a hospital, professor treatment, and very likely some expanded range of medical services as well. The hospital sector is very big in Germany. There's some 1,900 hospitals in Germany with close to 500,000 hospital beds, right? 400,000 physicians, plenty of pharmacies, right? And once again, it's the largest employer sector, right? 7.5 million people working in healthcare in Germany. So how is it funded? I mean, most importantly, statutory health insurance, of course, right? Accounting for 57% of expenditure that's a 57% share of those 466 billion. However, on the second place already is the private households, right? This is consumer health, but also this is the patient sometimes having to pay share of his treatment or of the devices or aids that he needs to purchase for his treatment, for example, right? And then there's a social long-term care insurance, and private health actually on 4th place, which is under proportionate, right? It's private health, it really accounts for 11% of the population precisely, but only for 8% of all expenditure. And this relates to the community, right, that is able to pay for private health insurance. So there's a, let's call it a health bias within those target groups. There's differences in the private insured and the statutory health insurance patient communities, right? Whoops. Okay, got the wrong buttons. Here we go. This is just a dashboard on medical technology per se in Germany, right? Spending 37 billion euros annually. This is the latest number of 2020. So we expect it to rise. There's constant growth, about 3-4%. And then, of course, Corona gave us an extra jump. There's about 1,400 manufacturers based in Germany, right? Companies that are manufacturing. And for statistical reasons, we're just looking at companies that have more than 20 employees. Exports is super important for German industry in general. The country has been export champion for many years. The last couple of years, it has been to and fro between China, right? China has become the export champion once or twice, and it's to and fro with Germany in that sense. Medical technology, very high export rate. There's considerable innovation going on, right? Actually, Germany is leading the patent application ranking at the European Patent Office. Regardless, we do import significantly, right? This is about 50% of all expenditure relates to the worth of imports that's coming from international sources. So people really here are used to foreign brands and importing, etc., right? And the first jump you have to take, as Richard said, is the CE mark, but by far it's not the only one. Take a look at those hospitals. Already reflecting that jump we have seen with Corona, right? In 2020, there was a considerable increase in hospital spending, reaching a total of 114 billion euros already. And that's about an average case cost or expenditure per case of over 5,000 euros. It's a lot of money. The number of hospitals per se is going down slowly. There's a trend to see concentrations, right? Hospitals are becoming bigger, and small hospitals are being phased out very slowly. This also has to do with reimbursement regulation, right? There's a threshold in many cases where a hospital has to demonstrate a minimum of a number of cases and operations in a specific diagnosis-related group, for example, in order to be reimbursed, right? The administration wants hospitals to be able to specialize and do not have a plethora of, let's call them too small hospitals, offering treatments in areas where they cannot generate the efficient numbers of cases, right? Right, so this is a look at the size of hospitals, distribution. Here we see that actually there's a lot of very small hospitals with less than 50 beds, right? And these would not be offering a full extent of services, right? The larger the hospital, the higher the scope of services. And we do see that there are some 95 hospitals with over 800 hospital beds. Most of those top 10 largest hospitals, the largest one is University Hospital of Berlin, called the Charité. It has just about 3,000 hospital beds, and most of those top 10 hospitals by size in Germany are university hospitals, right? So this is something you'll see at our Medica pavilion, right? This map here, brand new map. I'm very proud. We just published it 2 weeks ago. This shows the distribution of employment within the medical technology industry, right, throughout Germany. This is The idea was to give you an impression of where is the community bunched up in Germany, right? Where would you find those clusters, hotspots? This might give you just some orientation points through the German medtech industry landscape. Those little red circles are what we call individual innovation clusters, right? These are literally structured networks with membership in industry, in academia, in medical settings. They have management teams running trainings, running educational programs on incentives they have available in their specific region. For example, they will have get-togethers where they encourage their membership to discuss CE certification issues, right? MDR can be troublesome, can be quite a challenge, etc., etc. But the main point is that they bring together industry, academia, and medical settings for the sake of innovation, right? And this system is open to you, of course. We'll have several presentations at our pavilion with management representatives of those clusters. You're welcome to take a look here at www.gda.com, Medica. Perhaps you can arrange to drop by. There's no need to register, just drop in. And I see Michelle is coming back. That means I have to finish my presentation. Just to let you know, we're also prepared to provide information on reimbursement in Germany, right? So specifically, this is my job to provide information. I think people like Richard will take you by your hand and go through individual projects and make sure you get your certification market access running. My role is to provide information. Look forward to hearing from you. This was a great opportunity. Thank you, Michelle.
Thank you very much, Gabriel. That was really, really good. And just a comment, after we have a presentation by Phil Brown on regulation and MDR, whilst we'll go into a Q&A. So if anyone's got any questions, if you can put it into the chat and we can address those at the end. So if I can move on now to Phil, and firstly, thanks, Gabriel, again. And as he said, he'll be at Medica, so please do make full use of your time there and have a conversation with him to find out more about the German market. But Phil, hi and welcome. Phil's been with ABHI for over 6 years and over 30 years of industry experience in European regs and standards. What Phil doesn't know about UK and European regulations and MDR, well, it's not worth knowing. So over to you, Phil.
That's very kind, Michelle, but I can assure you that every day is a school day. And, you know, you're always learning new things and trying to understand new things. So you'll be glad to know that I don't have any slides this morning, but what I'm going to do is to try and give you a little bit of an update on where things are with European MDR, but also then maybe try and marry that in with what's going on with the UK and some of perhaps of the opportunities that we have moving forward. So I know probably a number of you and it was a good comment earlier on in that previous presentation where, you know, there was maybe some challenges with MDR. Yeah, there are challenges with MDR. If you think about the Medical Device Directive, when that first came in, that had around 50 pages within it, a very elegant piece of legislation covering everything from tongue depressors through to CAT scanners. And everything in between. The medical device regulation is now 250 pages, so it's a huge document. The big thing that it incorporates is a lot of text which is taken from what are essentially standards. So you'll see in the new medical device regulation, there is swathes of text which cover quality management systems. There are swathes of text which cover clinical investigations and post-market surveillance. There are huge chunks on risk management. So in the olden days where you used to be able to rely, olden days, that's terrible, it's making me feel really old now. But when, if you look at the Medical Device Directive, where you could rely on compliance with standards to demonstrate that your product is in line with the regulation, you now have a legal obligation to do those things. And that means actually that, and people that have heard me before will get fed up with me saying, I'm sure that that really translates everything now to make medical device regulation a business process rather than a pure technical requirement for products. It's really important that the chief executives of companies, the people who really drive our industry, for example, have processes for management review or product review as part of their systems. And they have, because the signature on declarations of conformity implies that level of understanding. So it really is a business process. And of course, what we're trying to do is to make sure that regulation is a facilitator of trade rather than being a hurdle to trade. So integrating regulatory in with business is really the best way that you can manage stuff. But that doesn't mean to say, as we've already heard, that the transition to MDR has been easy. Moving from 50 to 250 pages means that notified bodies in Europe are struggling for capacity. The notified bodies have now got that much more information to actually absorb and to approve as part of their technical reviews and their quality management reviews. So because of that, and because of the legal imperative now that notified bodies are put under, means that they are much more thorough in the way that they do their work, which means they're stressed with time. So there are a number, of course, of issues around capacity with notified bodies, and I know a number of you are probably suffering from not actually having notified body time or finding time with notified bodies to even start the conversation about regulating your product. That capacity issue is echoed across the world, actually, and it's not just within notified bodies. There are capacity issues within competent authorities. There are capacity issues within industry. Maybe some of you have seen how difficult it is to actually find people to do your quality management system work for you, bringing them in, or consultancies to do that work for you. So one of the big things which we've been pushing, particularly as ABHI, is that educational element, and making sure that we can find people who have not only the ability to understand what the regulations are, but how that then integrates through business, because clearly getting that right first time will save you as the manufacturer that much more effort and time. So conformity assessment bodies, that's a real challenge. In fact, it's a challenge so much that the European MDCG, Medical Device Coordination Group, have published some guidances recently on how to perhaps look at integrating the MDR in a little bit more of a pragmatic way by looking at things like remote auditing and how remote audits can be carried out, whether they need to be done as frequently as they currently are. So again, there's a number of initiatives that the European Commission are sort of introducing through this medical device coordination group. And as we know, the Commission have already started to Okay, so Julie, I've got your thing. It's MDCG 2022 document 14. So if you do a 2022/14 and MDCG, you'll probably come up with that document. But the Commission, as you know, have already started to introduce some detail on how to transition through the implementation of the MDR. So they're already sort of talking about a year's worth of delay on that, and looking at certification and sort of grandfathering a certification. So again, just as a recommendation is to look at your certification very closely, speak to your notified body about how that sort of can be transitioned through. There are options. If we go to certification, we talk about certification a little bit more closely. A number of companies, this all sounds like a real big challenge, the MDR. There are some really good things about MDR, by the way. But looking at some of the things which are a little bit more challenging, certificates and grandfathering of products really sort of tied in with that conformity assessment body capacity issue means that a number of companies are facing issues of not being able to get their MDR certificates in time to cope with the date of application for the MDR. In those sorts of situations, and there have been a number of those in the UK that we've been helping with at this moment in time. In fact, I had two in the last couple of weeks, actually. The best recommendation is to obviously speak to your notified body, see if they can't sort of speed things through. You're then left with really two options. Firstly is to make sure that you've got product in your pipeline and managing your logistics. But then secondly, to maybe even consider things like the exceptional use applications into individual competent authorities. Sadly, that is a national requirement, so you have to sort of send in applications to bridge that gap between your MDD certificate and your MDR certificate with individual competent authorities. But it does mean that they can potentially act as a de facto notified body for you and actually then sort of allow your product onto the market whilst you're transitioning from one regime to the other. This then begs another question. Michelle, please tell me to shut up when it's my time. But this begs another question as to what's going to happen with the MDR moving forward. The MDR, as we can clearly see, not only from these immediate things that we've sort of been talking about, but maybe with new products, innovations, integration of digital programs, or integrating diagnostics with devices and digital. There are lots of things that the MDR can't cope with, and lots of overlaps with other sort of regulations. So there's going to be a period of time where Europe will be using these regulations, but I think it's around 7 years' time, 8 years' time, the Commission will have to review the effectiveness of these regulations, and they will start looking at maybe what the next step will look like. Clearly, if we're moving from MDD to MDR to the next iteration, that next big technical leap is going to be very difficult for us as manufacturers to cope with. So I firmly believe that there will be a rethink in how the process of regulation is actually applied. That's one of the things which we're looking at clearly here in the UK, and maybe even those things that we're looking at as a Brexit opportunity here will be seen as a European opportunity in that sort of 7 years' time. So we'll see where that leads to. that could end up with a lot more global recognition. It could end up with a lot more emphasis on things like the International Medical Device Regulators Forum, who sort of provide countries with guidances and standards to work with. So those are the sort of rosy, sunny uplands that we can sort of look forward to. Unfortunately, at this moment in time, because of this transition from old to new, there are those challenges. The BV Med have been very vocal in the challenges, and they've been speaking with the European Commission quite openly as to the difficulties that we're facing. Michelle, I think I'll probably stop there because I've probably overrun with time, but I'm more than happy to take any questions that people may have. I'm sorry I sounded a little bit depressed there. I didn't mean it in that way, you know. It's as I say, there are some really good things with the MDR. It's really sort of taking technology to the next level when it comes to safety and performance. And of course, we always have to remember that you have new technologies, but you've still got the patient at the other end. So you've still got to cover, make sure from a safety perspective that the regulation can cope with those new innovations. But anyway, I can take any more questions. I should really be quiet now.
No, not at all. Thank you very much, Phil. That was great. We were running a little bit late before you arrived, so just making sure that you get enough opportunity to discuss these requirements. It's all very important for all companies involved at Medica to be aware of your sort of advice and interpretation of what's going on at the moment. And would you say that is there any particular advice or common mistakes that you say a UK company often makes when it comes to these European regulations?
Common mistakes. That's a really, do you know,
loaded question.
It is. Do you know what? That is one of the most insightful questions I think I've ever had on a Q&A. Common mistakes. What I will say is that it's a common mistake for manufacturers particularly to think that the regulator knows everything. The regulator doesn't know everything. The regulator relies on you as manufacturers in many ways to be the technical experts in their products. So the most important thing that you can do as manufacturers, if I was to do it sequentially, is to, I wouldn't even pick up the MDR to start off with, actually. If you're brand new to this game, pick up a copy of the old Medical Device Directive. Now, that may sound a bit daft because it's defunct and it's no longer used, but the MDR is based on exactly the same principles. And trying to read 50 pages is much easier than trying to read 250 pages. So if you look at the MDD, the Medical Device Directive, you can get an idea of how all of the regulations sort of sit together, how you drive risk through your product, how you apply quality management, what the sort of essential principles of technical conformance is. So you can get a picture as to how that all sits together, then tackle the MDR, because it's then the next stage. Annex 1 in the Medical Device Medical Device Regulation is the most important one, potentially, and that is what's called the General Safety and Performance Requirements, GSPRs. Every product has to meet those GSPRs, whether you're a class 1 low risk hospital bed or you are an orthopedic implant. So you have to go through that list. It's a checklist. You go through and say, these apply to me, these don't apply to me. And you then have to support your compliance with technical data as a result. The easy mistake to make is not picking those up at an early stage and thinking right, I've done it, I'm the expert on all of these things, I know I'm the expert on it, so I don't have to worry about that. Pick up the MDR GSPRs and then sort of make sure that your product sort of sits well within that. The other big mistake is not recognizing that risk management really drives that whole development process and is a living process. It was a fella who's much cleverer than me who said to me once that whenever you're doing regulatory compliance, never let the ink go dry on your applications, right? So always go back to it, always revisit it, because the state of the art will always change. So if you've got your product, you get your CE mark, don't just sit on your declaration of conformity, think what's happening beyond that, and then sort of use that information which you get through risk management to drive what version 2 of your product is going to look like, or to drive out anything which might be potentially harmful from your product. Again, remembering you've got your patient at the end. That was a fantastic question. I'm not sure I answered it. I'll have to do an essay on that one, Michelle.
I think that was fantastic, really, that insight that you gave, and I think that applies to many concepts of business, really, of always constantly looking forward and never ticking something off the list, really. I think we all strive to have that opportunity to constantly reassess what we're doing and have we got the right approach to it. Gabriel, if I could draw you back in and just ask you a bit of a prediction in terms of Medica itself. Are you prepared for a certain type of question that you think is going to be the most common for companies coming to you at Medica?
Yeah, right. Okay, I'm thinking. I think the common questions are what's new about MDR, right? There's some aspects that haven't been finalized yet by the EU Commission. For example, the database that they're putting together, they call it UDAMED. It includes those UDI aspects, so unique device information, pieces of information that you have to publish on every single product, actually by batch. So that's still ongoing, as the colleague just said. It's a living process. And of course, they will ask about reimbursement, right? And there's two things that you have to know about the German reimbursement system. One is it's clearly distinguished or distincted between the outpatient and the inpatient system. They're completely different. However, they share one aspect, that's coverage by evidence opportunities. And the other thing is that one fantastic thing about reimbursement in Germany is that basically any product can be reimbursed on already existing DRGs. So from that point of view, it's very innovation friendly. But the catch here is, of course, that the amount of funding may not be very sufficient to build a sustainable case right away. And then there's pathways to increase that reimbursement and get your own individual DRGs and operations procedures codes, possibly. This is about those questions that I would expect.
Yeah, interesting. That's fantastic. And
Michelle, as well, that's absolutely right. When you look at our industry, 95% plus of the manufacturers or companies in this space are SMEs, and they have tremendous innovation pathways. And that link between innovation and availability of product is a hugely important link. It's one of those things, I'm sure it's the same in Germany, that you can have the smartest regulatory system in the world, but if the health system can't buy your product, then it's completely wasted. So that's one thing that we're looking at in the UK, and I'm sure it's the same that every other country in Europe is looking at. How do we ensure that innovation from that 98% of health tech companies can reach the patient? And that's the real difficult link, I think. So regulation is great. And reimbursement is great. We just need to make sure that they're linked together.
Beautifully summarised. Thank you very much. Thank you, Phil. If anyone else has got any questions, do feel free to pop them in the chat quickly. Otherwise, as I mentioned, you're more than free to email me directly or either the speakers of today's webinar. We will make this presentation available on the ABHI website and also share slides with you as well directly via email. It's been an absolute pleasure having you all here today, and yes, I'm not going to count down the minutes until Medica. I think we're all aware that it starts on Monday, and I hope you're all getting prepared and ready for it. Just a brief opportunity here to say that myself, Lottie McMahon and Jonathan Evans, my colleagues at ABHI, will be at the show and available for you to come over and talk to us about anything that any support that you're requiring. Obviously, we do quite a few events, Medica just being one of them, but if you're interested in the Middle Eastern market, then we also run Arab Health, of which there are still some stands remaining. And Lottie runs the US Accelerator as well, which I know she's in recruitment for at the moment. We also have CMEF and also Future Surgery in London, which will be running at the same time next week, at the same time as Medica. So hopefully we're all able to enjoy the benefits from all of these events, and do get in touch with me directly. So thank you, Gabriel. Thank you very much, Phil, for all of your time and support today. And thank you, everyone, for joining.
Thank you.
Cheers. Bye-bye.
Take care. See you at Medica, hopefully.
Bye. Will do.
Absolutely.
Yeah.
Bye.
Take care. Bye-bye.